Good afternoon and thanks for joining us. I'm Judy Simpson. Advancements in medical care over the past half-century are nothing short of astonishing. New drugs and surgical techniques, along with technologies such as medical imaging, are helping us live longer and more productive lives. But those advancements don't come overnight. It takes years of research and trials, especially when it comes to advancements in diagnosing, treating, and preventing cancer. Joining me are two guests from the Vermont Cancer Center. Dr. Claire Verschragen is the center's co-director, and she is a professor in the UVM College of Medicine, and Kimberly Lubers is an assistant dean in the Clinic Research Administration, which oversees clinical research at the Cancer Center, UVM, and Fletcher Allen. Thanks so much for being with me today. I think this is really a very interesting topic. Let's start with some of the basics. What is a clinical trial?
So a clinical trial is really an attempt to answer a medical question. And so I will give you an example because I think it's easier to understand what a clinical trial is with an example. If you take the case of breast cancer patients, in the past they used to have a very mutilating type of surgery where the whole breast was removed, the whole lymph nodes under the axillary pit were removed, and that caused them to really have what's called lymphedema, a big swelling of the arm that made them almost incapacitated, very difficult to handle, fine movement, etc. And so the University of Vermont, the idea came that maybe it was not necessary to remove all the lymph nodes under the axillary pit because most of the time we couldn't find any cancer inside them. And so came the idea of what's called a Sentinel lymph node, where you inject a tracer around the cancer in the breast, and the tracer then goes through the lymphatic channel within the first lymph node, which is called the Sentinel lymph node, because that's where the first path of the cancer cells would be. And the tracer is radioactive, so during the surgery you take a probe and you figure out which one is that lymph node, and you just resect that one. And then you submit it to a microscopic evaluation to see whether there is cancer cells or not inside the lymph node. And if there is no cancer cells, then you don't remove the lymph nodes anymore. And so that has really prevented more than half the patient this big lymphedema, and they keep a good function of their arm after the surgery. So that question could not have been answered outside of a clinical trial because it was not the standard practice to do that, and we had to prove that eventually that was a better way of looking at the surgery than the old way.
That's
incredible. And so a clinical trial is really trying to answer a question, and the question is, could this be better than what we're doing?
So I think we have still a couple of pictures that we want to take a look at because it sort of traces out what the trial does, and it treats to treat cancer and to find and diagnose cancer. That's a diagnostic study. Prevent cancer, which is primary or secondary prevention. Manage symptoms, which is something that you talked about, the side effects in its treatment. And then assess the psychological effect of cancer on patients. That's a behavioral study, so those are some of the different kinds of trials that you do.
That's correct, yeah.
And so why are trials conducted?
So we design trials and conduct them to add to medical knowledge. We're looking at how we treat patients, how we diagnose them, how we prevent disease and conditions, and then looking at how we treat them, what kinds of medications, what types of surgical approaches, as Claire described in her example. For prevention, looking at how cancers develop, understanding that mechanism, and then looking at how can we change that trajectory, prevent the disease. We also look at how we can implement interventions. Some of our research is about exercise and nutrition and implementing healthy living, healthy lifestyles, and how that can change the trajectory of a disease.
So we may know that it's a good idea to take care of ourselves and eat the right foods, but what you're trying to do is scientifically prove that that's the case.
That's correct.
And so who conducts clinical trials?
So clinical trials are conducted by principal investigators. They're clinician scientists, and they're responsible for the study, but there are also other individuals in the research team, so clinical research nurses and clinical research coordinators that help the conduct of the study, and then the other healthcare professionals that are involved in patient care.
It's really a team effort because, even though there is one team leader who is called a principal investigator, which is a term that you find in the Code of Federal Regulation, by the way, so it comes with real responsibility. one person cannot do everything.
Right.
So you have a team that helps you enroll patients on trial, that helps verifying that the patient is eligible for the trial, that helps you giving the treatment or the procedures that the trial is written for. And then at the other hand, if there is a specimen that needs to be analyzed, then you need to have the specialist that can analyze that specimen or that procedures to help you giving you the results that you're looking for. So it's really a team effort by people that are trained in something called good clinical practice, which is really a requirement to be able to do those trials appropriately.
And so who participates in clinical trials? Can it be anybody?
So patients generally participate in clinical trials, but there are trials that involve significant others or family members of patients with a specific disease. But we at the hospital are actually engaging our patients in clinical trials.
Yeah. So, I mean, there are clinical trials with healthy volunteers, and I'll give my own example. When I was a resident, I was offered to participate in a trial of a new antibiotic. And so the first thing that happened, I had to sign a consent form, and then they drew some blood out of me for looking at the baseline parameters. And then the next day, the principal investigator came running to me and says, "Oh, Claire, your creatinine is way too high." And it was like I was in renal failure.
Really?
And so I looked at it, and effectively it was high, and I think I just had not drank enough. So I went to drink a bit, and we redrew it the next day, and I was totally normal values. I was just a bit dehydrated when the trial started. So after they repeated it and I was in normal value, then I just swallowed that pill of antibiotic and had some repeat blood tests after that. And it was a very short trial of one pill I had to take.
Well, let's talk a little about that, because that seems like a simple trial, but there are some that are pretty complex.
Yes, there are a lot of the cancer oncology clinical trials are complex. We're treating patients who have significant diseases, and so the trial itself actually has oftentimes for the treatment trials many months, and then the follow-up is actually for years. So we follow patients for 10, 20 years just to see how the long-term outcomes of their diseases and how their response is to the treatment that they received.
Why do people participate in trials?
There's many reasons for it. In cancer patients, I think it's always the hope that something is going to be better than the treatments that we can offer, because not in every situation, because we're getting better, but in still most situations of metastatic cancer, we don't really have curative treatments. So having a clinical trial to offer with a new drug or a new way of delivering the treatments gives hope to patients. But other patients choose to do it because they are just like heroes. They volunteer their life to participate in some unknown procedure or treatment that may help other people. So that's another reason why people participate in clinical trials.
Sometimes it's actually to have access to the latest medications. Part of clinical trials is actually going for FDA approval of a medication or a device or an intervention, and until that FDA approval happens, the only way to access those treatments are through clinical trials.
And so are there different types of clinical trials?
Well, there are many types of clinical trials, but if you look at treatment trials, so trying to figure out whether a new drug will work in a certain type of disease, you usually start with a phase 1, and the phase 1 is really trying to understand what is the right dose for that patient, and looking a little bit at pondering the side effects with the dose that the patient is receiving. Usually for these types of trial, we take anyone who's gone through a standard of care and did not respond to it, or the cancer came back. Then there is the phase 2 trial, where we're trying to figure out whether the drug could have some efficacy in a certain type of disease. And we also try to better understand the panel of side effects that could come with the dose that we give to the patient, the dose that's being found in the phase 1 trial. And then in the phase 2 trial, if we see that there is a bit of efficacy without too much toxicity, then we move to a phase 3 trial, where we take the standard of care, that is the current one at the time that the trial is designed, and we compare it with the new drug that has gone through the phase 2 trials. And so from the phase 1, you have about 10 to 20 patients. On the phase 2, you have about 30 to 100 patients, and on the phase 3, then you start getting in hundreds of patients, depending on the difference that you expect to see in between the standard of care and the new drug, which could be the new drug plus the standard of care. So it's not always the new drug alone. And these trials usually in cancer look at the length that people stay free of cancer or the time that people survive with their cancer. And if we do see a difference, then the study goes for FDA approval, and once the FDA has approved those trials, there is usually a mandate to do phase 4 trial, which is really to refine the experience that we are gathering with these new drugs.
Wow. So what should someone know about a clinical trial before they agree to participate?
So clinical trials, individuals really should be informed about the risks and benefits associated with participating in a clinical trial. And as Claire alluded to earlier, that process is called informed consent. And so we go through the risks and benefits associated with participation in a clinical trial. But there's also a number of questions that people should ask when they're being approached about participating in a clinical trial. They really need to know what's being studied. They need to ask questions about what will they have to do? How often are they going to have to be coming either to the hospital or to the clinic? Is there hospitalization? Are there certain tests that need to be done at a certain time period? And all of that's covered in the informed consent document, but asking those questions just so that they better understand what exactly it is that they're being involved in.
And then there are some other questions too to talk about a little bit about pay. Do people who participate get paid often?
Some patients get paid for their participation. It depends on the type of study. In general, oncology trials or cancer trials don't pay for participation. There are stipends available to reimburse patients for some additional expenses that they may incur as a part of clinical trial, maybe pay for parking because they're coming more frequently than they normally would, so paying for parking or for gas expense, that type of thing. And those are things that are also included in the informed consent document. We're required by law to disclose those types of compensations and reimbursements as part of the informed consent process.
So Claire, can you tell me a little bit about some of the trials that you are doing or have done?
Okay. Well, I really work with new drugs, so I participate a lot in the early trials, the phase 1 and the phase 2. And as an example of a drug that started very early and is now commercially available, I will take the drug called ipilimumab, which is basically what's called a monoclonal antibody, which is a protein that recognizes melanoma cells and triggers an immune process in the host, so that the immunity of the patient being stimulated is able then to put a cuff on the melanoma and sometimes eliminate it. So that drug started development probably about 10 to 14 years ago, and has gone through a bunch of different trials and is now currently available commercially for the treatment of melanoma. So I participated in 5 of the studies before the drug was available commercially. It's currently available for people that have metastatic melanoma, and we are still studying it in patients that have localized melanoma that has been resected but that are at high risk for recurring. So we have here some patients in Vermont participating in this trial and either getting the ipilimumab or being randomized to what's called interferon, which is the old standard of care. And the outcome of the trial will probably take another 5 to 7 years before we really know whether giving this medication earlier in the course of the disease helps patients or not.
And Kim, quickly, what about some of the ongoing trials going on at the Vermont Cancer Center?
Sure. So we have treatment trials for specific diseases, as Claire's described. We also have trials where we're looking at prevention of cancer or prevention of secondary disease, so exercise and nutrition. Dr. Dittis is working on those. We have trials where we're doing a single blood sample and collecting that sample and doing analysis on that, or storing it for future research studies. There's a lot of opportunities for participation in oncology.
If people are interested in finding out more about the trials, what should they do?
So for Cancer Center, the Vermont Cancer Center clinical trials on our website, Vermont Cancer Center website, we have a clinical trials network and list all of our active trials. There's also the clinicaltrials.gov, which is a website that clinical trials nationally are registered. Internationally are registered. And then also things like the National Cancer Institute has information about clinical trials participation and the types of questions that we talked about earlier with regard to what you should know and what questions you should ask.
I want to thank you both for joining us today.
Thank
you.
you.
That's our program for today. I'm Judy Simpson. We'll see you again next time on Across the Fence.
For a video copy of today's program, call toll-free 1-888-ATF-3430. Across the Fence is brought to you as a public service by University of Vermont Extension and WCAX-TV.